Hello everyone. So this is my older adult oral video presentation. The stage that I decided to focus on and that I found to be most prevalent during my interview was Erikson's stage 6, intimacy versus isolation. This stage focused on young adulthood, and kind of like a general synopsis of the stage is that young adults are looking for intimacy and closeness in their relationships. They learn to give and take with a significant other without sacrificing their identities. If they are unable to establish intimacy, they are at risk for isolation as they move into adulthood. This is about from 18 years old to 40 years old. Some of the important life experiences that happened with my interviewee during this time, she was facing independence as an individual. She, at around age 18 to 19, she moved out of her home with her mother. She was on her own and then was in a relationship that became very abusive and toxic. Shortly after, she um, was in a relationship with another individual who she ended up becoming married to for some time, who she had her son with. So she was going through a whole lot of different experiences that played some type of role on relationships. Some challenges and accomplishments through this time. The first one was with her relationships. As a young adult, she was maintaining and kind of like altering her relationships with her parents and her siblings because she was no longer at the care of her parents. She was taking care of herself financially, maintaining like a job and then maintaining a home. Other relationships include like personal relationships that she had with individuals where they either ended because they became toxic, or ones that turned to marriage. And then a big accomplishment that she had was like her perseverance and her will throughout her time through those relationships where there were difficulties. She figured out what was best for her at the time, whether it was like getting out of that relationship. She focused on her son and just kept going with life and like did not let anything get in her way. Some parts that were involved when resolving the psychosocial crisis, it included establishing relationships. So, finding a relationship with individuals or a significant other that was positive and like impactful in a good way to her life, not toxic, and then kind of eliminating those toxic, relationships. Continuing with existing relationships, included like family and close friends who she had impactful times with and like relationships with, so that she continued those things throughout her life to help avoid the isolation and keep, that intimacy level with those significant people in her life. Some biopsychosocial factors that affected my interviewee's life was her strong willpower. She came from a super strong family who, always had her back and like supported her in everything that she did, which kind of leads into having a very supportive family and friends. And she was always hardworking. She worked every day that she could, even while she was pregnant or like struggling or facing adversity. She was constantly like pushing herself to be that person that she wanted to be for her child and herself as well. Some factors that could have like affected the resolution of the crisis of the stage was her religion and faith. She did end up terminating the marriage between her father's child because it became unhealthy. That can go against, like personal biases who, marry one person and that's who you're with forever. She had to, kind of alter those um, values for herself because it was no longer like safe for her. Her socioeconomic status, varied throughout her life because she was supporting herself as a young adult and then maintaining a place of living. And then she had some economic support from significant others, but then those are no longer there and she had to take care of her son. So the multi-systems lens, in this case, she had a lot of things that were impacting her life, whether that was her family who were there to support her. She had various jobs and work roles. A lot of them involved working in a nursing home as an aide, and then that eventually turned into her job at a facility for individuals with disabilities that became her career, which she actually recently retired from. So all of those things had different impacts, and even more so did her relationships with others, like significant others, the relationship with her son. The theory that I chose that relates to stage 6 of Erikson's theory is Kohlberg's stage of moral development. Around level 3, which is the post-conventional morality, and stage 6, which is the universal principles, which is a time where people start to develop their own set of moral guidelines. This can be like human rights, justice, equality. We set our own guidelines, and then that's what we base ourselves off. We no longer, as a child, you have these ideas of justice and equality and things that you want for your life. But as you become an older adult, you realize that maybe not all those things are as true as they once seemed, or they don't seem as capable of getting there. Some limitations of Erikson's psychosocial development theory is his impact of culture on the stages. Everyone has, a different culture, including their spirituality, ethnicity, religion. There's just so many different levels of culture that aren't reflected in his stages. Also, research that is conducted for his theory is primarily based on males. And then there is a lack of explanation for mechanisms of the crises, and then it's more focused on childhood than adulthood. Thank you for listening.